when Susan received a diagnosis that shook her to her core, a brain tumor. The medical team presented her with the option on a brain biopsy to diagnose the type of brain tumor she had. She denies. Not happy with Susan's decision, the neurosurgeon appeals to her family to help change her mind. Though everyone in the family agrees that Susan should pursue the surgery, Susan remains adamant against it. Within 4 weeks after being admitted, Susan returns to the ED unconscious and unresponsive. It is determined that her condition is due to the enlargement of the tumor. This time, an MRI with gadolinium is performed to determine the exact status of the tumor. Shockingly, the radiologist reading this scan questions the original diagnosis. The tumor on the present scan lacks characteristics of the type of malignant tumor it had previously been thought to be. Its homogeneous appearance leads him to suspect a meningioma, usually a benign tumor. If true, this would change the likelihood of survival. More than 60% of patients with meningioma survive at least 10 years after surgery. However, Susan's only hope of survival still depends on surgical removal of the tumor, and the risks of surgery, including cognitive disability, remain the same given the placement of the tumor. The neurosurgeon again approaches the family and, despite Susan's verbal statements about surgery, tries to get them to provide their consent for it. Again, all are in agreement, but Susan's sister, who insists that the surgery not be done because that is not what her sister would have wanted, and she made that very clear. The neurosurgeon protests, saying that Susan made that decision with the wrong information, and since she is no longer competent and without an advance directive, her previous decision does not stand. Ethically salient elements navigating Susan's decision.
The principle of autonomy recognizes the inherent right of patients to make informed decisions about their own bodies and healthcare, ensuring they are fully informed and free of coercion. Susan's decision to forego surgery was a testament to her autonomy, her right to weigh the potential benefits and risks of treatment, and make a choice that aligned with her values and personal beliefs.
Beneficence, the ethical principle of acting in the best interest of the patient, often guides medical recommendations, ensuring that the patient's welfare is prioritized. However, beneficence must be balanced with non-maleficence, the obligation to avoid causing harm, ensuring that no unnecessary harm comes to the patient.
Justice, the principle of fairness and equality, also comes into play, particularly in ensuring that all patients receive fair treatment.
In the realm of Catholic healthcare, patient autonomy stands as a fundamental ethical principle. It underscores the right of every individual to make informed decisions about their own body and healthcare. This principle recognizes that patients are not passive recipients of care, but active participants in their own health journey. Respecting Susan's autonomy means ensuring that she is fully informed about her diagnosis, prognosis, and all available treatment options, including the option to forego treatment altogether. It means providing her with clear and understandable information about the potential benefits and risks of each option, including the risks and benefits of the brain biopsy. This information should be presented in a way that is sensitive to her emotional state and cognitive abilities, ensuring she can fully comprehend the information.
Furthermore, respecting Susan's autonomy means honoring her values and preferences. It means understanding what is important to her in terms of quality of life, independence, and potential treatment side effects. Does she prioritize aggressive treatment, even if it means potential side effects that could impact her independence? Or does she value quality of life over quantity, even if it means foregoing potentially life-extending treatments?
Susan's voice, her values, and her preferences must be at the heart of all decisions made regarding her care. This Catholic patient-centered approach is not simply about providing medical information. It's about engaging in a genuine dialogue, building trust, and empowering Susan to make the best choices for herself.
When faced with challenging choices, healthcare professionals must balance their expertise with compassion. It's crucial to consider the patient's values and wishes, even when the path forward isn't clear.
Indeed, these decisions can be incredibly complex, requiring a careful evaluation of all available information and a deep understanding of ethical principles.
Upholding ethical standards is not just a professional duty, it's a moral imperative. We must always strive to respect patient autonomy, beneficence, non-maleficence, and justice.
Absolutely, and by adhering to these principles, healthcare providers can build trust, foster meaningful relationships, and ultimately deliver the highest quality of care.
It's crucial to consider Susan's wishes and values in this situation. We need to ensure that her autonomy is respected throughout the decision-making process.
Indeed, balancing medical advice and patient preferences can be challenging, but it is essential for ethical patient care.
Susan's perspective reminds us that healthcare isn't just about the interventions we can provide, but also about the quality of life and personal dignity.
Respecting her journey means acknowledging her right to make decisions about her own life and care. It's about supporting her in a way that aligns with her values and wishes.